Right, so here we go then. Extraordinary omission. Key findings in scathing UK COVID report. So the joint report by the Commons Health and Science Committees on lessons to be learned from the UK's response to COVID spans 150 pages. That's why I'm not going to be digging into it fully today. Here are the main findings from each. Okay, so planning for a pandemic. The section on preparedness draws on concerns highlighted by The Guardian as far back as May 2020. It finds that the UK was confident of the extent of its pandemic planning, despite most of it being too narrowly and inflexibly based on the idea of a flu-type outbreak. The planning did not properly consider asymptomatic transmission or take into account earlier outbreaks that failed to reach pandemic level, such as the SARS virus affecting East Asian countries in 2002 to 2004, or the MERS virus first identified in the Middle East in 2012. Alright, so this is something that we've kind of been colloquially saying all along, is that how didn't they learn from SARS and MERS? Very, very effective responses to SARS and MERS in East Asian countries that more or less provided a blueprint for how to respond to a pandemic. Yet, none of those learnings seem to come overseas into the UK's response. So yeah, the UK government didn't learn the lessons that it had available to it from SARS and MERS. But then, okay, detailing various government exercises about hypothetical pandemics, it said an over-reliance, here's the quote, over-reliance on pandemic influenza as the most important infectious disease threat clearly had consequences. It meant that the emphasis of detailed preparations was for what turned out to be the wrong type of disease. And perhaps the most vivid piece of evidence in this section came from Dame Sally Davies, England's former chief medical officer, who blamed what she called groupthink. The report quoted her as saying, "Our infectious disease experts really did not believe that SARS, or another SARS, would get from Asia to us. It is a form of British exceptionalism." British exceptionalism. This is something that I say all the fucking time on this stream. What makes our government so confident that it can behave in different ways to the governments of other countries, to the same threats, and get a different response? What made the UK government think that its COVID response would be so wildly different from other countries, have the same kind of demographics, the same kind of geography, and get a different result? British exceptionalism. Where does it come from? Right, lockdowns and their timing. Among the most fractious debates in the response to coronavirus been over the timing of England's lockdowns, both when the first one was imposed in March 2020 and apparent delays in putting in place another in the autumn and the winter of that year. On the first lockdown, the report is clear and condemnatory. Factors including a lack of testing capacity and doubts over whether British people would accept a lockdown prompted scientists and politicians to adopt a policy approach of fatalism, that's a quote from the report, which would seek to manage but not suppress, look at that, manage but not suppress the extent of an outbreak. While this was not an active decision to seek so-called herd immunity, it amounted to this in effect, the report said. So, what they're trying to say is that the government approached this in a sense of, we can't reach COVID zero. They gave up on that early doors. They gave up on keeping numbers as low as possible, and to the point of removing COVID cases from the country, right? As happened in New Zealand, right, is I think the most popular example. So that's what they've called their, in quotes, policy approach of fatalism. Manage but not suppress the extent of an outbreak. But they're also pointing out that there's a difference between that and herd immunity, which is a strategy that the government has been accused of trying to follow. herd immunity strategy where you just let the virus essentially run through the population and try and get to the point where, say, 50-60% of the population has had the virus and built up immunity to it. Of course, the obvious reason that's a shit idea is because it results in thousands and thousands, tens of thousands of unnecessary deaths. But what they've said is, essentially by not trying to suppress and rather trying to manage, it amounted to, in effect, herd immunity and that strategy. It amounted to the same thing. Following what the committee called simultaneous epiphanies by ministers and advisors about the catastrophic effects of this approach, a UK-wide lockdown was finally announced on 23rd of March. The report said, quote, "It is now clear that this was the wrong policy and that it led to a higher initial death toll than would have resulted from a more emphatic early policy." So I think that's a very long-winded way of saying too little too late. Quote, "As a result, decisions on lockdowns and social distancing during the early weeks of the pandemic, and the advice that led to them, rank as one of the most important public health failures the United Kingdom has ever experienced." One of the most important public health failures the United Kingdom has ever experienced. Probably the most important quote from it so far. That's the one certainly that I've seen in the most headlines and summaries of this report. For obvious reasons. The report was, however, more equivocal on whether the ministers should have imposed a circuit breaker lockdown in England in late October 2020, saying the emergence of the more transmissible Alpha or Kent variant could have prevented this being effective anyway, and that a circuit breaker in Wales did not prevent a winter lockdown. So they're trying to be fair. They're trying to say that there is a way that even if this was put into place, it could have been thwarted. Speculative, right? So it moves on to test, trace and isolate. So the UK did not have any kind of tracking system in place for a long fucking time, despite repeated calls for doing it. At one point, James O'Brien on LBC Radio did a phone-in where he took calls from people that were working on the app, people that had been employed to work on the app, and many of them reported that they were being paid to just sit at home and do nothing. So, test, trace and isolate. The report's most consistent and vehement condemnation came in this section, beginning with what it described as hugely serious failure to even try to copy the rapid rollout of mass testing in places like South Korea. So that's probably the best example of where it worked, South Korea. Public Health England claimed to have studied and then rejected the South Korean approach, but could provide no evidence for this, the report said, adding, "We must conclude that no formal evaluation took place, which amounts to an extraordinary and negligent omission." So, they're accusing the government of looking at South Korea, seeing a track and trace system going brilliantly, and saying, This meant testing in everywhere but hospitals was halted, and so new cases or contacts could not be tracked. As a result, the UK squandered a leading position in diagnostics and converted it into one of permanent crisis. The consequences of this initial failure were profound. For a country with a world-class expertise in data analysis to face the biggest health crisis in 100 years, with virtually no data to analyse, was an almost unimaginable setback. So far so good, eh? While testing capacity was later increased hugely, the report noted that government rhetoric was still often notably more impressive than the reality. Quote, "Ministers began by promising the test and trace system would be world-beating in May 2020, when the truth was that it was a laggard," it said of the system, which had a budget of £37 billion. The report also castigated the low numbers of people who complied with self-isolation rules, citing a lack of financial support and the continued requirement to self-isolate for 10 days, long after tests were freely available to show that they did not have the virus. So, they're not only saying that self-isolation wasn't financially supported by the government, who can just stop working, they're also saying that they didn't give tests necessary to actually check whether people needed to self-isolate once they had been. Failure on both counts. If you don't pay people and you make it negatively consequential for them to be truthful about their state of infection, likelihood is they're not going to comply. You won't have public consent. Now, that's something that seems obvious in hindsight. Maybe it's something that we know about this kind of thing in general. But anyway, it's nice to see it cleared up in a report. Right, so moving on to social care. This is, of course, where the pandemic really started to expose the weaknesses in the pandemic response of the UK. More than 39,000 care home residents died with coronavirus between 10th of April 2020 and 31st of March 2021. Right? More than 39,000 care home residents died with coronavirus between 10th of April 2020 and 31st of March 2021. The report finding that ministers and the NHS, quote, both failed adequately to recognise the significant risks to the social care sector at the beginning of the pandemic. The committee concludes, quote, the UK was not alone in suffering significant loss of life in care homes, but the tragic scale of loss was among the worst in Europe and could have been mitigated. Therefore, deaths were avoidable, in other words. Some of these failures were specific to the pandemic, the report said, including the decision to focus on freeing up NHS capacity and thus release many patients into care homes without COVID tests, and problems with a lack of personal protective equipment. So as I was saying earlier, even though there was people warning about a pandemic coming, there wasn't preparation for it. Others, such as a shortage of staff and funding difficulties, were, quote, illustrative of a long-standing failure to afford social care the same attention as the NHS. This is one of the known truths of British politics, is that social care is in dire straits and needs long-standing attention. This is why, to the government's credit, they have actually addressed, finally, some of the lack of funding to social care. The problem of that is, of course, I have seen the earlier stream on this, they did this by increasing national insurance contributions from everybody, even the lowest paid workers, when there were other more fair alternatives, like taxing the wealth, even a one-time tax on wealth, or increasing inheritance tax, for instance. So then this is the second to last point here. So wider health inequalities. The report stressed that the experience of the COVID pandemic underlines the need for an urgent and long-term strategy to tackle health inequalities, a point highlighted by politicians and experts during the pandemic. It noted the particularly high toll of COVID on people from minority ethnic backgrounds and on people with learning disabilities. It said, quote, it is telling that the first 10 NHS staff to die from COVID-19 were from Black, Asian and minority ethnic backgrounds. And evidence has since confirmed that the impact of COVID-19 on this section of the workforce has been significant. While the NHS has made progress in recent years, the experience of people from Black and ethnic minority groups during the pandemic has made it clear that inequalities persist. Now, health inequalities were there before. Different kinds of treatments of Black and Asian folk in hospitals. Disproportionate number of Black mothers dying in childbirth. But as with everything else, the pandemic just accelerated the differences in our society. And this is a good example. Alright, so the last point here then, vaccines. The UK's only real, for my money, objective success when it comes to the pandemic in comparison to other countries, above and beyond the leader in vaccination rates. However, all of that progress was quickly scuppered when Johnson let in the Delta variant. It meant that we needed to hold off on opening up again. More businesses suffered, and of course there were more avoidable deaths. So what does the report say? Vaccines. While the report gives recommendations on lessons to be learned from the development, procurement and distribution of vaccines, these were mainly based around other areas of government learning from it, particularly the flexibility and speed of the vaccines task force headed by Kate Bingham. The COVID vaccine programme overall, the report said, has been one of the most successful and effective initiatives into the history of science, UK science and public administration. So this is, as I would probably predict, the only real overwhelmingly positive point. I really encourage you to look into the report yourself. The link is in the bio. Looking at these points in the summary, you can see really vaccinations was the only thing that was majority positive, right? The only thing that was such a success that there really doesn't need to be any kind of damning point on the other side of things. I would argue that the vaccine success was quickly made bitter by letting in a vaccine-resistant variant. But I suppose credit where credit is due. There we have it.